Welcome to MCQs Mastermind. Subscribe.
Question number 1. The most common causative agent of hospital-acquired pneumonia is? The right answer is C. Pseudomonas aeruginosa. Question number 2. Which of the following pathogen is a spore-forming anaerobe? The right answer is B. Clostridium difficile. Question number 3. The toxin-producing gene in Corynebacterium diphtheriae is encoded by? The right answer is B. Bacteriophage. Question number 4. Which pathogen is associated with gastric ulcer and carcinoma? The right answer is A. Helicobacter pylori. Question number 5. Which virus is oncogenic and linked with cervical cancer? The right answer is C. Human papilloma virus. Question number 6. Which of the following is a gram-negative intracellular pathogen? The right answer is B. Chlamydia trachomatis. Question number 7. The main virulence factor of Streptococcus pyogenes is? The right answer is A. M protein. Question number 8. Which of the following is responsible for whooping cough? The right answer is B. Bordetella pertussis. Question number 9. Dengue virus is primarily transmitted by? The right answer is A. Aedes aegypti. Question number 10. The most common fungal pathogen causing systemic mycosis in immunocompromised patient is? The right answer is A. Aspergillus fumigatus. Question number 11. The hallmark of Mycobacterium tuberculosis infection is? The right answer is B. Casseting granuloma. Question number 12. Which virus uses reverse transcriptase to replicate? The right answer is C. HIV. Question number 30. E. coli strain O157-H7 produce which toxin? The right answer is C. Shiga-like toxin. Question number 40. Which of the following is not a DNA virus? The right answer is D. Rotavirus. Question number 50. Which protozoan pathogen causes severe diarrhea and is acid-fast on microscopy? The right answer is C. Cryptosporidium parva. Question number 16. The bacterial capsule contribute to virulence by? The right answer is B. Resisting phagocytosis. Question number 17. Triphonema pallidum is best identified by? The right answer is C. Dark field microscopy. Question number 80. Which of the following bacteria causes gas gangrene? The right answer is C. Clostridium perfringens. Question number 90. Which virus can cross the placenta and cause congenital anomalies? The right answer is B. Cryptomegalovirus. Question number 20. The most common cause of neonatal meningitis is. The right answer is C. Group B streptococcus. Question number 21. Lyme disease is caused by. The right answer is B. Borrelia burgdorferi. Question number 22. Which of the following virus is double-stranded RNA? The right answer is B. Rotavirus. Question number 23. The infection prion protein legs. The right answer is D. Nucleic acid. Question number 24. The causative agent of anthrax is. The right answer is C. Bacillus anthracis. Question number 25. Which of the following is a zoonotic pathogen? The right answer is C. Brucella abortus. Question number 26. The primary host for Toxoplasma gondii is. The right answer is B. Cat. Question number 27. Which of the following pathogen is transmitted by ticks and causes relapsing fever? The right answer is B. Borrelia recurrentis. Question number 28. The enterotoxin Staphylococcus aureus causes. The right answer is B. Vomiting and diarrhea. Question number 29. Rabies virus belong to which family? The right answer is B. Rhabdoviridae. Question number 30. Atypical pneumonia is commonly caused by. The right answer is B. Mycoplasma pneumoniae. Question number 31. Which bacterium causes typhoid fever? The right answer is C. Salmonella typhi. Question number 32. Plasmodium falciparum is known for causing. The right answer is B. Cerebral malaria. Question number 33. Which of the following virus has a segmented genome? The right answer is C. Influenza virus. Question number 34. A gram-negative Diplococcus causing urethritis is. The right answer is A. Neisseria gonorrhea. Question number 35. Which fungal pathogen is commonly associated with bird trophic? The right answer is C. Cryptococcus neoformans. Question number 36. Which bacterial component is responsible for toxic shock syndrome? The right answer is B. Superantigen. Question number 37. The causative agent of scarlet fever is. The right answer is B. Streptococcus pyogenes. Question number 38. What type of organism is Giardia lamilia? The right answer is C. Protozoan. Question number 39. Which pathogen is associated with lockjaw? The right answer is B. Clostridium tetani. Question number 40. Which virus causes parotitis? The right answer is B. Mumps virus. Question number 41. Which parasites causes anemia by feeding on the host blood? The right answer is B. Ankylostomum duodenale. Question number 42. The primary reservoir for the rabies virus is. The right answer is B. Dogs. Question number 43. Which bacterium can survive in bile and cause chronic gallbladder infection? The right answer is B. Salmonella type. Question number 44. Rickettsia is transmitted by. The right answer is B. Tick bite. Question number 45. The causative agent of walking pneumonia is. The right answer is C. Mycoplasma pneumoniae. Question number 46. Which of the following is a dimorphic fungus? The right answer is C. Histoplasma capsulatum. Question number 47. Which virus is transmitted via contaminated food and causes hepatitis? The right answer is C. Hepatitis A. Question number 48. Kafusi sarcoma associated herpes virus is. The right answer is D. HHV8. Question number 49. Which organism causes neonatal conjunctivitis and pneumonia? The right answer is B. Chlamydia trachomatis. Question number 50. Which helminth is known to cause microcytic anemia and protein loss? The right answer is C. Ankylostomum